Okay, so today we're going to talk predominantly about sudden illness. I'm going to cover everything and anything that's most important for you guys to know. So our objective today is to be able to list types of sudden illness, describe what cares can be used, what could cause them, and also how to prevent any from being more serious or from occurring at all. In terms of current events, I didn't give you guys one this week, essentially because we spent Monday, Tuesday, and Wednesday in the media center. But next week we'll have two due again. It'll be blue and it'll be yellow next week. So we're getting to the end here. I think it's the second one that you need blue and yellow. Am I correct, or is it the first one for this quarter? No, it's the second one you need for the new quarter. Monday's the halfway point of the quarter. So we're almost done with my class. Next week, we're going to kind of unwind a week like this. I'll finish up anything I need to cover in terms of sudden illness. I'll talk about heat and cold emergencies. I'll talk about senior, pediatric care, special needs people who might need care on Monday and Tuesday. That's going to happen. On Wednesday, we will work on our first aid fair trifolds in class. I'll have everything you need: glue sticks, tape, markers. I'm going to see the art department for some construction paper for you. Anything and everything you might need to put together. So most of you have already told me that you have printed everything out, or you plan on printing it at home in color, or having a parent print it for you in color. Make sure that you have it here with you for Wednesday. Okay, make sure that it's here with you for Wednesday, and I will give you consistent reminders. If you don't have it here with you for Wednesday, then it's going to be on your time, because I'm not going to give you additional time to go ahead and work on this. I'm giving you a whole class period, that way I can help out in any way, shape, or form in putting it together for you. And I have examples over there that you'll be able to look at, and some of them are really outstanding in laying yours out very similar to what they've done. Then Thursday and Friday next week, we are back in the media center. We're still working on the first aid fair project, but it's going to be for other aspects of it. It's not going to have anything to do with the trifold. And I'll cover that next week, what we'll be focusing on next Thursday and Friday up there. But we're getting to a point now where we need to really start getting the pieces of the puzzle together, because about a week before we actually bring them into the media center and do our first aid fair, I like for you to have them out in the classroom and explain yours for everybody. So we're getting to the end of the class here, to be quite honest with you, even in instruction that I'm giving. Any questions about any of that at all from anyone? Okay, great. So sudden illness. By knowing the signs of sudden illness and paying careful attention to details at the emergency scene, you can determine how best to help a person experiencing sudden illness. So this is a brief, well, not brief, this is about an 8-minute video from the American Red Cross, and it talks about some important stuff. On page 32, you're going to write down some facts about a stroke.
Determining how to help a person who becomes suddenly ill can be difficult. Some illnesses can strike with no warning, including fainting, seizure, stroke, diabetic emergency, allergic reactions, poisoning, and fever. Common signals of sudden illnesses include dizziness or unconsciousness, trouble breathing, signals of a heart attack such as chest pain, discomfort, or pressure that may spread to the shoulders, arm, neck, jaw, stomach, or back. Signals of a stroke, such as sudden weakness on one side of the body and sudden trouble with speaking or getting words out, loss of vision or blurred vision. Signals of shock, such as rapid breathing and ashen skin. Sweating, persistent abdominal pain or pressure, nausea or vomiting, diarrhea, or seizures. Certain sudden illnesses require specific care. In general, to help a person experiencing a sudden illness, do no further harm. Monitor breathing and consciousness. Help the person rest comfortably. Keep the person from getting chilled or overheated. Reassure the person, and give any specific care needed. Call 911 or the local emergency number for the following conditions: unconsciousness or altered levels of consciousness, trouble breathing or no breathing, signals of a heart attack, persistent abdominal pain or pressure, severe external bleeding, vomiting blood or passing blood, severe or critical burns, suspected poisoning, seizures, stroke, suspected or obvious injuries to the head, neck, or spine, or painful, swollen, deformed areas, or an open fracture. A seizure is the result of abnormal electrical activity in the brain that causes temporary, involuntary changes in body movement, function, sensation, and awareness or behavior. Most seizures last only a few minutes and can include the following signals: a blank stare, a period of distorted sensation during which the person is unable to respond, uncontrollable muscular contractions called convulsions. Call 911 or the local emergency number if the seizure lasts more than 5 minutes. The person has multiple seizures with no signs of slowing down. The person appears to be injured or fails to regain consciousness after the seizure. The cause of the seizure is unknown. The person is pregnant. The person has diabetes. The person is a young child or an infant who experienced a febrile seizure. The seizure takes place in the water. The person is elderly and could have suffered a stroke. Or the person has no known history of epilepsy or seizures. If a person is actively seizing, remove nearby objects that could cause injury, protect the person's airway, and allow the seizure to run its course. Attempting to stop a seizure or restrain the person can cause injuries. Do not place objects or fingers into the mouth of an actively seizing person. Recovering from a seizure usually takes just a few minutes. The person may be disoriented and drowsy. Reassure the person as you monitor his condition.
What's your name?
Okay, so before we look at fevers and febrile seizures, any questions about the other seizures they just talked about? Anybody ever experienced anybody just bust into a seizure?
Not a person, but I used to babysit a dog who had epilepsy, so he had probably 4 or 5 seizures over the times that I watched him. And that the main thing was just get a towel, put it under his head so he didn't basically bang his head around.
That's all you can do when somebody has a seizure. I know there's an old school thought that you can actually, put a spoon in their mouth so they don't bite their tongue off and all this kind of stuff. I mean, you don't do anything. You clear the area where they are so that they don't bounce into something and get hurt further. And if you can get a towel or a pillow or a jacket or something to put under their head, you do that so their head doesn't bounce off the floor. But that's really about it. You let it run its course. I have a friend from back in Pennsylvania who he was about 19 or 20 and he was in a car accident going 15 miles an hour and he hit his head off the dash.
Wait, 50 or 15?
15. He hit his head off the window in his car. He didn't have on his seatbelt. He hit his head off the window, and it messed with his head really bad internally. He actually had to have some surgery, and he has a plate in his head now. But it's caused him to have seizures where he is at the degree where he feels something coming on, and he can tell you, hey, I think something's going to happen here. I haven't seen him or been around him for many, many years now, but that used to be the way it was. I can remember one time the first time I ever experienced it, I was with he and my nephew, and we were going to a concert. He was telling us a story, and my nephew was sitting in the back seat, and I was driving, and he was kind of like this. And he was talking, and he was using his hands. He's a Italian kid, telling you to use your hands and talk. Guess you can figure that out with me. Anyway, he's talking, and he's doing this, and all of a sudden he stops. And he starts shaking really bad. And I'm like, oh my God. We're on a big highway, like a 270 type of highway. So I pull over the side of the road, and I jump out, and I go around. And my nephew jumps over the seat, because I had a two-door car. And he comes out and he goes over there and we open the door up and we're like, oh my God, what do we do? All of a sudden he stops and he throws his head back and I'm like, oh no, you know? And this is before cell phones and stuff. And we stood there for like, I don't know, maybe 30 seconds, a minute. It seemed like a year. And all of a sudden he opens his eyes and he looks around. He's like, what are you guys doing? And we're like, well, you know, you just stopped telling the story and you had a seizure. He's like, yeah, so get back in the car. Let me finish the story. But he knew what was happening and he knew how to respond to it. It was never a big deal with him. One time he did it. We were out. It was Thanksgiving and a bunch of us used to meet up at a local watering hole. A whole bunch of us, and the place was completely packed. And he felt it coming on, and he told the people that were standing around, and he didn't drink alcohol, he probably still doesn't to this very day, but he told people, hey, this is going to happen. And it was like 1 o'clock in the morning, so the place was really packed. So they moved the stools out of the way, and he had his little seizure, and he's bouncing on the floor like a rubber ball. Next thing you know, he stops, and he sits up, and he stands back up, and he's like, okay, so, you know, like he literally handled it very well, at least when he was a lot younger. I don't know from there. I know he wasn't supposed to drive. And one time he was driving, and he was going the speed limit, which was like 55 or something like that, and he had something go wrong, and he, bam, slammed right into a telephone pole and destroyed a car. He walked away from it, but, you know, I mean...
If fever occurs when a person's body temperature is higher than 100.4 degrees Fahrenheit, fevers are common in children and infants. Signals of fever include skin that is hot to the touch, chills and body aches, headache, trouble sleeping or oversleeping, drowsiness, and lack of appetite. Additional signals for infants include being fussy and crying, becoming listless, and rapid breathing. Young children and infants with a fever over 103 degrees Fahrenheit can experience a heat-induced seizure called a febrile seizure, lasting less than 5 minutes. Febrile seizures are not usually life-threatening and produce different signals, which include a sudden rise in body temperature, change in the level of consciousness, rhythmic jerking of the head and limbs, confusion, drowsiness, crying out, becoming rigid, holding his or her breath, an upward rolling of the eyes. Call 911 or the local emergency number if the child or infant with a fever has signals of a life-threatening condition, such as unconsciousness or trouble breathing. For a child who has experienced a febrile seizure, call 911 if it's the child's first seizure, or if the seizure lasts longer than 5 minutes, is repeated, or is followed by a quick rise in temperature. Infants younger than 3 months with any fever, and children less than 2 years with a high fever greater than 103 degrees Fahrenheit, require immediate evaluation by a healthcare provider. If the child or infant has a fever, make him as comfortable as possible. Encourage rest and make sure he drinks plenty of clear fluids. If the child has a high fever, gently cool him. Never rush cooling down a child. If the child experienced a febrile seizure, rapid cooling could bring on other complications. Remove excess clothing or blankets and give him a sponge bath in lukewarm water. Comfort him as you monitor for changes in his condition. Before giving a child any medication such as acetaminophen, contact a healthcare provider. Do not give aspirin to infants or children under 18 years old. Aspirin has been linked to Reye's syndrome, a serious medical condition that affects the brain and other internal organs.
Okay, so before I get into the last one, which is stroke, let me just tell you that any of you that plan on having children, at some point when you have a child, they're going to get their teeth come in. And when they get their teeth come in, it's very uncomfortable, and sometimes that can happen. They can spike a really high fever with the potential of going into a seizure. Being a parent doesn't come with a manual. So I learned that through my friends who had a child before my wife and I had our children. Their oldest daughter, who's just a year older than my daughter, but they were at my house visiting, and she got a fever, was crying uncontrollably, and the fever shot up like to 103, 104, so they called the doctor, and the doctor basically said, you know, this is what's going on. The baby's getting her teeth in, and it's causing her body to have this kind of reaction to it. So this is what you should do. Well, after they did that and the baby's fever didn't go down, they actually went to the hospital, and when they came back from the hospital told them the same thing that the nurse on the phone told them. Look, you just need to be patient, give the baby a sponge bath, keep the baby cool and comforted. But babies usually cry for just a couple of reasons. They're hungry, they're really tired, or they pooped their diaper. Okay? That's usually why. So if all three of those things are status quo and they're continuing to cry and you check the temperature, it's most likely that's what's going to be one of the results of it, depending on their age. 18 months, 2 years, that's when those teeth start coming in and issues can occur. So just so you know, that will come down the road for you potentially.
A stroke or brain attack occurs when blood flow is blocked from reaching part of the brain. A stroke can cause permanent damage to the brain if not treated soon after the onset of signals.
Okay, stroke. Lack of blood flow to the brain. It's going to be different than fainting because it's going to get cut off with a stroke.
A person experiencing a stroke needs immediate medical attention. When a person is suffering a stroke, she can experience weakness or numbness of the face, arms, or legs, severe unexplained headache, facial droop or drooling, difficulty speaking or comprehending, vision loss or disturbance in one or both eyes, dizziness, confusion, agitation, loss of consciousness or other severely altered mental status, loss of balance or coordination, trouble walking, or incontinence. For a stroke, think fast.
Okay, you need that. That's what I wanted you to write down there. Fast. Face, arm, speech, and time. This is going to show up on your test, the last test you take, which is the first aid test. And you'll take it before, obviously before the end of the semester, but this is on there, and she's going to explain how to go through it.
Face, arm, speech, time. F stands for face. Ask the person to smile, then check to see if one side of her face droops. A is for arm. Ask the person to raise both arms to check for weakness or numbness in one arm. Watch for one arm to drift down. S means speech. Ask the person to repeat a simple sentence. Is the person slurring the words or able to repeat the sentence correctly? T stands for time. Make note of the time the signals first appeared. If the person shows any signs of a stroke, call 911 or the local emergency number right away. Care for any conditions that you find until EMS personnel take over. Reassure the person and have her rest comfortably. Do not give her anything to eat or drink. Continue to monitor the person and note any changes in her condition. Relay all the information to EMS personnel when they take over.
Has anybody in here ever experienced anybody having a stroke? It's pretty frightening. This is many years ago. I was like 24, living in my hometown, in an apartment, working on the other side of town. But anyway, my uncle had a stroke, and my parents called me like at 7 in the morning. They're like, hey, can you come over? Randy had a stroke. And ironically, I grew up in a neighborhood where my grandmother lived in one house, and my aunt and uncle and a bunch of my cousins lived in another house, and then down the street, another aunt and uncle, and then my family. So we all kind of grew up like that. Hello, Mr. Burdick. Do you see what I'm doing right there? Like, I tried what you told me to, but it's not necessarily. Will you be magical? You are magical, Mr. Burdick. Tough? That's awesome, thank you so much. Thank you so much.
No problem.
So basically, he has a stroke, and the scariest part about it is, have a great day. He can communicate with me, or at least think he's communicating with me, but he's not really communicating with me because he's got this slurred thing going on, the mouth droop, and all that kind of stuff. Where somebody having a heart attack can still be cognizant and say, hey, these are the signs that are going on with me. Somebody having a stroke is going, and it's scary. You know, it really, to me, it's almost scarier than dealing with somebody in cardiac arrest who you know, hey, if I don't work hard here and try and save their life, they're not going to live. Or somebody who's having signs of a heart attack, obviously they're communicating with you and you can get them 911. Somebody having a stroke is just right in front of your eyes, you know, is just really ill, and you cannot do a whole lot about it until the EMTs arrive. So, if you've never experienced it, good. I hope you never do. All right, so going ahead here. In your packet, top of 31. I've kind of outlined for you the things I want you to get down on. Signs of sudden illness, heart attack, or possible heart attack, stroke, or shock. Those are three big ones. Everything else is pretty much status quo there. We've talked about those things for countless numerous different injuries and illness that can occur. How do you care for these things? Monitor the person, keep them comfortable, reassure them. And I'd say as a rule of thumb, even though it gives you a little disclaimer up there, I'd say don't give them anything to eat or drink. Up there they're saying don't give them anything to eat or drink unless they're conscious and able to swallow and show no signs of a stroke. I wouldn't, in any uncertain circumstances, if you feel like somebody's having a sudden illness, go outside of that disclaimer and do any more than just saying, hey, look, let's get you cared for. You can eat or drink once things are taken care of. So that's how I would approach it. That's kind of like the reason I'm teaching it to you like that. Okay. Can we move on? Fainting. Partial or complete loss of consciousness caused by a temporary reduction of blood flow to the brain, whereas with a stroke it's more of a, I don't want to say it's permanent because it can be, you know, okay, you can be okay inevitably, but this is more temporary, you know, instantaneous, and then you come back around without any fallout from it. It could be a sign that something more significant is going on, but a sign of fainting, the one that I really want you to get is right here, loss of consciousness, then collapsing. When you feel that coming on, you should sit down or lie down so that you gather your bearings. That's the best thing I can potentially tell you. Sit down and gather your bearings. Okay, diabetic emergency. This is the inability to change glucose from food into energy. Two types. Type 1 is called juvenile diabetes. Usually you're born with this. You're educated from a very young age, once discovered, on how to care for yourself. You consistently have to check your blood sugar level to make sure that you're either producing enough or not overproducing. Type 2 has been on the rise for years now, thanks to technology. Type 2 comes along from people who are extremely overweight and inactive, eat all the wrong foods that leads to those things. Hyperglycemia, and I think it's important that you know the difference between the two. Your insulin level is too low because the amount of blood sugar that's being produced is too high. Hypoglycemia means your insulin level is too high because your blood sugar level is low. In either case, once you have been diagnosed with diabetes and you're instructed on how to care for yourself, it doesn't necessarily have to be a life-threatening situation ever. Two stories about it. Number one, I had an aunt who had diabetes and she didn't care for herself, and the amazing piece of it was, God love my Aunt Sylvia, but she worked as an emergency room nurse, and she didn't care for herself, and she lost a foot because she didn't care for herself, and then inevitably it took her life. And the other story is I had a kid who played football for me at Rockville. This was back in 06, I believe. Yeah, 06. And he had it from the time he was a small child, knew exactly what to do. And we had that open lines of communication. He always had what he needed there. He always had his little monitor on. He always knew when he needed to check himself. During a game, he would give me a different signal than anybody else who wanted to come out of the game because I knew what his issue was. Sometimes a kid would tap himself on the helmet, and I may not pull you out that very play, but that's one thing. But this kid, I knew if it was his diabetes acting up, he would give me a signal. He'd come over to the bench, check himself. He had supplies he might need to get his blood sugar level back to where it needed to be, and then he'd just come up and say, "Okay, coach, I'm ready." Back out he went. It was never a major issue, But it's, type 2 you can overcome, and I'll be honest with you. If you are diabetic or even borderline pre-diabetic, it's most likely for type 2 right now, and there are several things you can do, starting with exercise and eating right. All right, so moving along, signs of a diabetic emergency, 3 that I want you to get. You feel or look ill. You know that right away. Dizziness and headache and confusion. How do you care for it? Well, the predominant one I want you to get down is, and this is why they give you some juice or whatnot when you give blood, about 12-ounce serving of fruit juice, milk, or just a regular soft drink like Coca-Cola or Pepsi or something like that, just a regular one that has sugar in it as opposed to saccharin or something like that that's a sugar substitute. I know that kid always used to have like either a piece of candy or a little bit of soda or something. Every once in a while he might have juice over on the sidelines. Whether it was practice or game or whatever, he needed it, he got it. It was very rare in practice he had any issues, but he did have, he would come out of the game almost every week, for a little bit, just to check his blood sugar and make sure he was good. Chowder. Got a clip there where Chowder is.
My son Jackie was diagnosed with diabetes when he was 2 years old, just before his 3rd birthday.
Diagnosis was my first memory, and I don't remember feeling that awful.
I can tell about what I was doing the day before, the day of, and the day after when my daughter Kim was diagnosed.
I had to check my fingers almost 8 or 10 times a day.
Fortunately, after he had been using shot therapy for about 6 months, we were able to move to the Medtronic pump, and that really freed up a lot of our time.
Changing from injections to the pump has been a tremendous relief. It's a normal.
Especially with the support of the products that are available now, the technology, like what Medtronic offers with the MySentry, with the Real-Time Guardian constant glucose monitor, and especially with the pump, which is often an easier one to start with for a lot of parents.
The sensor when I'm snowboarding is like a godsend. It's so nice.
I feel that Medtronic is a very trusted partner. I've worked with them for the last 4 years, and they haven't let me down.
The pump changed my life with school and my life, because I didn't have to take injections anymore.
What I would tell a parent with a child that is newly diagnosed with diabetes is first that I understand that having a child with diabetes, especially in those first months, is tough. But you do come to a kind of normal that you can manage. And it's okay to feel the pain and the upset of what it feels like to have that complete turnaround in what you expected your life to be.
Okay, the reason I actually show you that little video is because, obviously it deals with diabetes, but they are constantly coming out with new and improved ways for detection of it. There's things that they will insert into your body now so that it detects it and will give off the right amount of insulin that you may need, or the right sugar that you may need to stabilize it, so you really don't have to stop and think about it like you used to have to do. It used to be that you prick your skin and get some blood and put it on you. Yeah, that's a thing of the past. All right, sudden illnesses and poisoning. Caring for poisoning depends on a couple of things. The severity depends on the type and amount of the substance, how long it's been in the person's body. Yeah.
Can you write? Never mind. I got it.
Okay. And the person's size, weight, medical condition, and age, which all makes sense. Once you determine there's been a poisoning, get the person away from the source of it if it's a safe scene. If not, then that whole thing has changed and you've got to decide how you want to approach it. But if it's a safe scene, get them away from it and call the National Poison Control Center. Okay. I know there's a question that's on there right now, and it asks for about a percentage that you can manage just by talking to somebody. And that's 70%. 70% of poisonings can be managed just from speaking with somebody. The 4 categories you're talking about: ingestion, inhalation, absorption, and injection. And here's just like poisons that are swallowed can come from drugs, food, medication, household. Food poisoning can be bacterial or chemical. All right, and there's some signs up there for you. Usually a lot of stomach pain, diarrhea, possible dehydration, and fever. Somebody who's been poisoned that they've ingested, you've got to be pretty careful with that. Don't induce vomiting. Let poison control tell you what to do. Poisons that a person breathes in the gas can be from a number of different sources. One of the biggest ones is carbon monoxide, and that comes off your car when your engine's running. Very, very dangerous. Very dangerous. Absorbed poisons, ironically, can come from plants, obviously chemicals. Okay, poison ivy, poison oak. All right, and it usually leaves some sort of rash-looking thing on your skin. You know, you can usually contact your doctor, or you basically, if you know what a poison ivy or poison oak leaf looks like, you can just go buy some over-the-counter medicine or something like that. Poisons that enter through bites or stings or injections with a hypodermic needle can come from a variety of different ways. They've really gone, I don't want to say to bad extremes, but they've gone to extremes so that when you get shots with the needles and stuff, they literally are cared for and taken away so that there can be no accidents from them. Poison prevention. Keep medications and household products out of the reach of kids. That's the biggest thing that you need to understand. Keep them away from kids. All right, we'll finish up with SED Notices 3 on Monday. Anybody have any questions about anything I just covered in terms of SED Notices? Fast formula.
Face.
Speech and time. Good. Really important, guys. Really important to understand.